as you watch the development of the COVID pandemic over the last 2 years, yes, you can observe that in terms of infected cases and deaths by regions, Asia's Pacific region stands out, as a region with less failures than other places. And there should be something in there that why these whole regions and can fares a little bit better than other places in the world. And if you look at from Korea, Japan, Hong Kong, Taiwan, and down to the Singapore and the South Asian country, and even Australia and New Zealand, that's we are attacked by this virus again, but other words, that's the whole region as whole, kind of faring much better if you compare to Europe and US. So the EPIC Hub itself has to find out some of the secrets in our society, especially the healthcare systems. And I come to a temporary findings that the governmental public health is very important roles in all these regions. They come with different forms, but always has a central government and the government in the middle and down to the bottoms that from grassroots. So take Taiwan as examples. We have Ministry of Health and we have 22 counties that has their health bureaus, and we have almost 350 townships. And these kind of structures with very sound public health workforce is running over the half centuries. So the public health force are there to respond to the pandemics with good contact tracings, with the quarantine enforcements and good communication, and even in the vaccinations. In addition to this, the universal health care systems in different forms in these areas, and with emphasis on primary health care, also play a very important role. We have medical centers, we have district hospitals, but we even have more primary health care clinics. And the ratios from the top to the bottom is almost over 200 or 400 times. That means you have a network of primary health cares on top of these good public health foundations. So these two features, I think that we have to stress much more in the futures of this resilience of healthcare systems we are developing. And I found this WHO and a lot of global bodies talk about a lot of primary health care, but they forget the government has a laws in public health, and that cannot be replaced by marketplace and market force. And if as we can see from these vaccine distributions, it's a big failure of market force. The nationalisms of vaccines procurements and all these kind of activity and the behavior actually hurt the equity of the world and damage a lot of people who are in urgent need over the past 10 months. So what can we do? In this ongoing pandemic, we have to rethink that in the past, we used to have this military industrial complex that dominate a lot of this strategy we are forming to fight the wars between countries. Now, we are fighting against the virus, but the countries and the industry are not working in the right way that we can form the most formidable force to resist the variants of this virus. So I think this global governance is needed in the futures, that South and North can have equal foot to put on the best public health practice to be used equally and among the countries. And I think that the experience of Asian Pacific regions can be a very critical reason. We can play a very useful role in the future's resilient society. As you can see, we are in a critical point of many supply chains, right? From food, medicine, sports, transportation. So this is really a very important area that has been underestimated in the past when we talk about global health security. So with this, we hope we can play more roles, and from our diverse cultures, economic and ethnic varieties in our regions, I think we can come up very robust solutions for the world to look at.